Bon après-midi à toutes et à tous. Good afternoon, everyone. La seule constante de la pandémie de COVID-19 est bien qu'elle change constamment. Le virus continue de changer, se transformant en des nouvelles mutations encore plus contagieuses. Et chaque fois qu'il change, nous n'avons pas hésité à nous adapter en conséquence. Nous sommes passés à l'action en nous fondant sur les données scientifiques et les analyses de spécialistes de façon à ralentir la propagation du virus et à limiter ses répercussions sur la population du Nouveau-Brunswick. The one constant of the COVID-19 pandemic is change. The virus continues to change, mutating into new and more contagious forms, and at each turn, we have not hesitated to change with it. We have acted based on science and expert analysis to slow the spread of the virus and limit its impact on New Brunswickers. Now we are changing our approach again to keep our people healthy and to protect our healthcare system. And by healthcare system, I mean to make sure that everybody who needs access to urgent, acute care will have access to acute care and ICU beds and hospital beds. Public health has always recommended that everyone wear a mask in indoor public spaces to protect themselves, their families, and communities. This has been an individual choice recently, but however, public health is now recommending that mask wearing be made mandatory across the province. Le Nouveau-Brunswick a établi un autre record en fin de semaine, 75 nouveaux cas de COVID-19 ayant été signalés samedi. Il s'agit du plus grand nombre de cas en une seule journée depuis le début de la pandémie il y a 18 mois. Avec les 199 nouveaux cas qui ont été ajoutés cette fin de semaine, il y a maintenant 484 cas actifs de COVID-19 au Nouveau-Brunswick. Over the weekend, New Brunswick set yet another single-day record. 75 new cases of COVID-19 were reported on Sunday. This is the most we have reported since the pandemic began 18 months ago. With 199 new cases added over the weekend, there are now 484 active cases of COVID-19 in New Brunswick. And that is very close to the volume of cases we saw at the height of the third wave back in January. We now have 23 COVID-19 patients in hospital, which includes 14 patients in ICU. The full list of new cases is on the GNB website, but I have to say that these are not the kind of records that we want to be setting. It's not about the volume of cases. We will continue to have cases for some time to come, and we did say that when we entered the green phase of our recovery plan. It's about who's getting infected and the impact this is having on our already strained healthcare system. And I mentioned our ability to provide healthcare services in the acute care setting and ICU and also regular hospital beds. It's a strain on the nursing staff and also our public health teams right now in terms of contact tracing and the number of cases that are happening. The great majority of new cases of COVID-19 are occurring among those New Brunswickers who are not fully vaccinated. The same is true of hospitalizations and ICU admissions. If you contract COVID-19 before your vaccine has taken full effect, you are at heightened risk of becoming severely ill, being admitted to a hospital, and potentially dying due to the virus. Those who are fully vaccinated can still contract the virus, but their risk of severe illness, hospitalization, and death is significantly lower. We are now seeing infections among fully vaccinated New Brunswickers, and again, we were aware that we could have breakthrough cases in that population as well, but certainly the effect on our healthcare system is much, much lower in those who are fully vaccinated. So these cases in fully vaccinated New Brunswickers are much less severe, but they still pose a threat to the general population. If you become infected while fully vaccinated, you may not immediately even be aware of it. Symptoms can be less noticeable, but you can still pass the virus on to others, people who may be much more vulnerable to its effects. This includes the frail, the elderly, and those with conditions that weaken their immune systems, and their bodies may not have the strength to fight back against infection, and it also includes those who cannot yet receive a vaccine. That means our kids, our children, your children. On Friday, the Minister of Education announced new measures to keep New Brunswick school students and staff healthy and safe. But we need actions that go beyond the classroom or school bus. Toutes les familles du Nouveau-Brunswick peuvent prendre des mesures immédiates pour protéger leurs enfants contre le COVID-19. La première mesure à prendre, et la plus importante, consiste de se faire complètement vacciner. Et je l'ai dit déjà, je veux le répéter, le numéro de fois qu'il faut pour que les gens reçoivent ce message important. La première mesure à prendre pour protéger vous-même, votre famille et toute la communauté, tous les Néo-Brunswickois, c'est de se faire vacciner tout de suite. Si vous hésitez personnellement à le faire, faites-le au moins pour vos enfants, pour ceux qui ne peuvent pas être vaccinés et ceux qui sont vulnérables au niveau de leur système d'immunité. Je suis très encouragée par le fait que de plus en plus de personnes demandent à se faire vacciner depuis quelques jours au Nouveau-Brunswick. J'espère que la tendance se maintiendra. Every New Brunswick family can act now to protect their children from COVID-19. The first and most important action you can take is to get fully vaccinated. Demand for vaccinations has picked up across the province over the last few days, and I am greatly encouraged by this. Please keep it up. We now have 77.8% of New Brunswickers fully vaccinated, and that's great, but we still need more to keep everyone safe. We still need more to keep the numbers of people being admitted to ICUs and hospital from rising. And I'm sure that many of you will feel frustrated that we aren't making the progress we all want to see. I can definitely relate. I think we didn't foresee that we would be in this particular position with respect to having our rates of vaccination plateau as they have. But now that we've gotten an uptick with respect to who has signed up to get vaccinated recently, again, we need to make as much progress as we can, as quickly as we can. So we've talked about during the pandemic that this is a dance. You can call it a dance, it's waves, it's a roller coaster, and we're riding those waves and we're doing this dance. And when you are dancing and things are going and changing, you have to step back and move forward with the music. This is what's happening with COVID-19, and COVID-19 really is controlling the setting of that music at this time. And pretending that it's not there would be disastrous for all of us. So please continue to have hope. We have come so far as a province. We have more work to do as a province. We do need to be doing it together on the same team, on the same page. And hope does continue to remain a powerful force. L'espoir nous permet de continuer.
Hope remains a powerful force and allows us to continue to work together to protect one another and act with kindness and compassion. We can get through this fourth wave of the pandemic.
Work together to protect one another and act with kindness and compassion. We can get through this fourth wave of this pandemic, just as we did through the first three waves. Thank you very much.
Good afternoon. Bonjour. The past few weeks have been difficult for all New Brunswickers, as we have seen our case numbers and hospitalizations rise quickly. As of today, 23 people are hospitalized, with 14 in the ICU. During the best of times, nurses work long hours under stressful conditions to provide patients with the best possible care. Over the past year and a half, the COVID-19 pandemic has caused working conditions for nurses to become even more challenging. And I know that many nurses have been struggling with the increased demands of their profession, of their position. Our nurses have shown exemplary commitment to ensuring all New Brunswickers receive the care they need. I have heard the challenges our nurses are facing. I know about incidents where nurses have been subjected to harassment and abuse, and this is completely unacceptable. I know that nurses are working with staffing shortages, which impacts the quality of care they can provide. And we must work together to correct this situation. I know of situations where nurses have had to walk through lines of protesters to get to their job. It must be extremely difficult to do that and then spend your shift working with patients in ICU that are unvaccinated. It's a difficult profession, and I commend them for the challenges they are facing and working diligently to help us get through this. I am also committed to having our government continue to work with nurses to ensure that they are being respected, work in a safe environment, and have the support they need to do their jobs properly to serve New Brunswickers who need them. Anything less than that is truly unacceptable. We must be able to do better. I'm looking forward to working together as we find more improvements going forward. Out of the 199 cases reported over the last 3 days, 152, or 76% of those cases, are not fully vaccinated. Our province is in the fourth wave of the pandemic, and that is why we've announced new measures last week that will come into effect tomorrow night at 11:59 p.m. After this date, people will be required to show proof that they are fully vaccinated when accessing certain businesses, services, and events. À titre de rappel, cela comprend les restaurants, les bars, les arts et sciences, les événements sportifs, les centres de divertissement, les centres de conditionnement physique, les rassemblements et les activités organisées à l'intérieur, ainsi que les visites dans les centres de soins de longue durée. We are working to develop a QR code to easily show proof that you have been fully vaccinated. But for now, people who are 12 and older can show an immunization record, a photo of your immunization record, or the vaccination record found through the MyHealth portal, along with a government-issued ID. Je sais que ces mesures vont avoir un impact sur les entreprises, les équipes sportives et les gens qui organisent des événements. Et c'est pourquoi je demande à tout le monde d'être patient à mesure que nous nous adaptons aux nouvelles règles. Mais ces mesures sont nécessaires pour nous aider à réduire les répercussions de la quatrième vague sur notre province. Please be patient with business owners and the groups who are simply following the rules. In addition to showing proof of being fully vaccinated, anyone entering the province after tomorrow night, including New Brunswickers who are returning home from other places, will be required to register their travel. Last week, Cabinet met again to discuss whether further regulations were necessary to protect New Brunswickers. As we already announced on Friday, additional measures have been put in place into schools today, including a return to classroom bubbles, physical distancing when possible, moving physical education classes outdoors, weather permitting, and no longer holding assemblies. But public health has made the additional recommendation that everyone wear a mask in indoor public spaces to protect themselves, their families, and communities. This additional measure has been approved by Cabinet, and it is recommended, and it will go into effect with the other regulations at the end of day tomorrow. Je sais que cela demandera une adaptation pour certaines personnes. Nous devrons nous assurer de reprendre l'habitude de porter un masque avec nous lorsque nous quittons la maison. We need urgent action by all New Brunswickers, regardless of your vaccination status, to slow the spread of COVID-19 virus. Until everyone who can be vaccinated has received their full course of shots, we must all take care to avoid catching or transmitting the virus. As of Wednesday, peace officers will have the ability to issue fines to people who are not wearing a mask in an indoor space. The return of the health and safety measures may feel like we are taking a step backward, but we must look at our current situation and consider what will happen if we do nothing. All of these measures combined will play an important role in slowing the spread of COVID-19 and protecting our healthcare system. So it is there to address all of our health needs, not just COVID-19. I appreciate that so many New Brunswickers have taken steps to protect themselves and the people around them by choosing to be vaccinated. As of today, 77.8% of eligible New Brunswickers have been fully vaccinated, and 86.5% have received their first dose. Nous allons lentement dans les bonnes directions. Mais tous les gens de Nouveau-Brunswick admissibles doivent se faire vacciner le plus rapidement possible pour nous permettre de traverser cette quatrième vague et pour ultimement sortir de cette pandémie. Our healthcare professionals have worked tirelessly to address the needs of the pandemic while also maintaining other essential care needs. Now they need our help to reduce the impact of COVID-19. We know that vaccination helps prevent serious illness. In the past month, 32 people have been hospitalized in New Brunswick. 3 of them were fully vaccinated and 2 were partially vaccinated. The rest, 27 people, or 85%, were not vaccinated. In this situation, 21 were over the age of 40, in the age 40 to 50. Primarily, the group below 50 is an unvaccinated group at the levels that we need. And the levels that we need mean to go from a 65% up to the 75 to 95 to 90, where currently they're running in around 67, 68. Between last Wednesday, when we announced our new measures, and this morning at 11 a.m., more than 6,600 people have booked an appointment for their first or second dose of COVID-19 vaccine. I am indeed pleased by this, and I am hopeful we will see the vaccination rates continue to rise in the days and weeks ahead. Hopeful that we'll be able to have a short term in the current regulation requirements, but right now we must do all that we can.
I know that everyone has had enough of this pandemic. Unfortunately, I can't tell you when we will be able to get back to a fully normal life where the health measures and safety measures will no longer be needed. But I can tell you that we will get there by working together.
By getting vaccinated, by showing proof of being fully vaccinated when required, by registering our travel, and by wearing a mask indoors, we're doing our part to protect ourselves and protect others, including children, who are particularly vulnerable right now. I thank you for your continued patience and cooperation as we continue to adapt to the COVID-19 pandemic. And we do so together in the way that we've done so in the past 19 months and the way that we've been successful in the past 19 months. Thank you. Merci.
Merci beaucoup, Monsieur Premier Ministre. Dr. Russell, thank you, Premier and Dr. Russell. Nous allons maintenant procéder aux questions des journalistes. Vous avez le droit de poser votre question dans la langue officielle de votre choix. Chaque journaliste aura une question et un suivi. Voulez-vous assurer de désactiver le son de vos micros, s'il vous plaît? We'll now proceed with questions from members of the media. Each reporter will have one question and a quick follow-up. You have the right to pose your question in the official language of your choice. And please ensure your microphones are placed on mute. We will start with Allison Sampson of CTV.
This question is from Russell. How many of the current cases announced over the weekend have you identified were in schools or are in school? Of school age.
Oh, breakdown of ages of the cases. Don't have the breakdown of ages in front of me, but I can get that for you. So Bruce can help with that after the press conference.
Do you plan for any additional measures to come into schools at the time? I guess teachers will now be wearing masks as well. Is there anything further that will be happening?
I believe that everything that was announced last week is what's being implemented currently. So we'll see what the effects of that are. We are trying to streamline our contact tracing process. As you know, people do get letters to notify them when a school setting has been impacted, and they were getting individual phone calls for close contacts, etc. Again, we're trying to streamline that because there's been a lag time between when people get notified with the exposure setting type of letter versus the close contact letter. So we're working with our partners to streamline that and make it a bit more simple and straightforward.
Thank you, Doctor. Thank you, Ms. Sampson. Tim Roselle, Global TV.
Thank you, Bruce. My question is for either Dr. Russell or Premier Higgs, whichever wants to take it. How much consideration was given to potentially going even further than an indoor mask mandate and perhaps moving back from green into a yellow phase or some modified version of that? I guess I'll start with that, and certainly we'll be having meetings, watching these cases closely, meeting with public health this week to determine next phases and if next steps are required. And I think it's important to realize that we will act in any way necessary to bring this under control and bring it back down. So we're anxious to work through the numbers and decide what next steps are required, but that could include any of the restrictions that we had in the past, as we might move back there to ensure that we get under control.
And I'll just add that, again, we started those discussions last week with respect to the initial conversations and presenting the information and the data that we had last week. And moving forward, again, all the evidence-based recommendations that have been put forward in the past, everyone is open to receiving that information again and walking through what steps need to be taken at this time to mitigate what's happening.
I do have a follow-up, Bruce, if that's okay.
It's okay.
This one's for Dr. Russell. Dr. Russell, I believe it was in an update last week where you had mentioned that we were pacing toward 100 new cases per day. Are we still on that pace? How close are we to it? And are we even beyond that now where it's going to be 125 or something like that? Do you have any idea?
I think we're on a steady incline towards that. So I don't think there's any change from that projection or that trajectory at this point.
Thank you. We will go to Vicki Hogarth, CHCO-TV.
Thank you, Bruce. Premier Higgs, how should a business deal with a patron who refuses to show proof of vaccination and refuses to leave the premises? Should they call the police? What steps should be taken?
Yes, that would be their next step. We will have clear instructions and we do have now for them to be available to post on their job site or on their facility, whether it be a restaurant or what have you, and then they can point to that as requirements by law. And if customers or people do not adhere to that, then they should indeed call for assistance.
Ms. Hogarth, do you have a follow-up?
Yes, it's probably for Dr. Russell. Can you elaborate on what our testing strategy currently is? How many tests are we doing approximately a day, and do you feel we should potentially be doing more just given the current case count?
Well, we've certainly seen an increase in testing in the last few weeks. And in terms of the approach, our main focus is still PCR testing. And but we do have, again, collaborated with all of the Chamber of Commerce organizations in the province with respect to point-of-care testing and how to use them, and we've distributed them throughout the province. So as of right now, again, we've ramped up our needs right now in terms of being able to address the demand, and we'll continue down that path.
Thank you. Erica Butler, CHMA.
Thank you. So I've heard from some concerned employees at the Drew Nursing Home in Sackville, especially regarding a delay in getting all employees tested on site. And I know previously Public Health has declared outbreaks at nursing homes and sort of updated the statistics particular to individual outbreaks. I'm wondering if you're planning to declare an outbreak at the Drew Nursing Home, and also have all the tests from this past weekend been processed for that home?
My situational awareness around that particular facility is such that, again, we know that there are some places that have declared outbreaks and some haven't. That particular location has not been declared an outbreak, so we're going to continue with the testing plan as it is and get people, we do the serial testing every so many days. And just to come back from a question that somebody else asked around ages of cases, 57 of the cases reported today are under the age, people under the age of 19.
Ms. Butler, do you have a follow-up?
Yeah, I've also heard from some residents in Sackville. One of them told me today it took a week to get a test booked and results back for their kids. I'm wondering if staffing levels at assessment centers have gone down after the third wave, and is there an effort to get them back up?
Well, we work very closely with our regional health authority partners in terms of making sure that the demands are met. And certainly if there's a lull and there's a decrease in demand, they do reassign resources as needed. So it does take, there's a little bit of a lag sometimes when there is an uptick in a surge in demand. So we're catching up now.
Thank you. Eilish Moning, CTV.
Hi there. My question could be for either Dr. Russell or Premier Higgs. Now that we are headed back to mandatory masks, do you still stand by your decision to remove the state of emergency and all the restrictions across the province, or are there any regrets around that now that we're in the situation that we're in?
Well, I can start with that, and then Dr. Russell may want to add as well. I think that, you know, making a decision back in August 1st to go green was one based on science and availability of information and where we were trending, and balancing the view of the public having a chance to experience New Brunswick again in a way that to see their families and the mental health issues that were kind of surfacing as a result of changes and exposures that they weren't having with family, friends, and neighbors. So, you know, it's easy to always look back and say, would you do anything differently? Well, based on the information that we had and the projections that we had, and the fact that we were intending that people would continue to be vaccinated and we'd reach the levels that we were focusing on, that was a disappointment that the vaccination levels dropped right off, which also may have been an indication they felt, okay, well, I don't need to get vaccinated now that we're in green. So that had an unintended consequence. But I think right at this stage, given the facts, I'd certainly do the same thing again. And I think a lot of people benefited from what they experienced over the summer period. And, you know, we're seeing cases rise around us that whether they made changes in the midsummer or whether they didn't make changes. So whether it would have impacted or not, it certainly may have. But at this point, you deal with what you have and you go forward. And I think that's something I just want to raise in relation to some of the statistics. You know, there's a lot of emphasis in schools and with kids, and we know that kids can react in different ways to the disease, whether it's to the infection, whether it's a variant or not. But they can contribute to infecting their parents and others. And you know, looking at cases, and I guess that the only stat, and I don't have for all the weekend, but for Saturday on there were 74 cases, which is one of the highest we've seen. The case, you know, we had about 75% of them that were 30 and under that were part of that case load. So 37 less than 30 and 19 less than 20. So my point is that kids can be transmitters back to parents, and then parents can transmit to each other. And that's where the whole thing comes into play. And then it's these parents that then end up in hospital. And then we end up with the backlog in ICU, or we start with the hospitalization increases, which is what we're seeing. So the idea in all of this is how do we control hospitalizations? How do we keep the numbers down in hospital? Because we've seen younger people can be impacted. They can spend longer in hospital, longer in ICU, and yes, ultimately, maybe have a higher success rate of getting out than older patients. But the point is that we're going to impact other hospitalization services, and we're going to impact the entire system, and much unnecessarily, because we're lower on vaccination rates than we should be.
Dr. Russell?
Yeah, I can just echo what the Premier is saying. It is a challenge at this point in time around the lower rates of vaccination than we were hoping for and expecting. And this is the challenge that we're faced with right now that is impacting our healthcare system today. and the risk for every New Brunswicker right now to be able to continue to access acute care is really our critical priority at this point in time. And again, the best way to address that is with vaccination. And yeah, that's really where we're at.
Ms. Bunning, do you have a quick follow-up?
Depends on the answer, I suppose. I'm hearing from businesses that fall under the mandatory proof of vaccination that goes into effect tomorrow night at midnight, that they're having concerns around obviously having to staff and ask for the proof of vaccination, but also wondering if that proof of vaccination is at some point going to be required from their employees as well as people visiting the establishments. Is there any sort of guidance that you have for them regarding that side of things?
With respect to it being mandated, that I can't answer, but I do know that, as business owners, their ability to protect their business in terms of being able to operate is something that obviously is boosted by having all of their staff vaccinated. So it's obviously in their best interest to protect their staff to be able to continue to operate at this time.
And if I was to add to that, I think what I would say is that as part of a transition to new rules and giving notice and then having some ability to work through that notice period, in addition to ongoing, we know how difficult it has been for many businesses that will be impacted by these changes to get people. We know that we've seen many people that are struggling with their business because they cannot get people to come to work. And there's various reasons for that, but of course we could get into that, but in relation to why people are coming to work and what options they have. So if you look at the actual situation at a business, then they have an option. If they cannot show proof of vaccines, then they wear a mask and they're tested regularly. And that is the option in order to, again, in our philosophy from the very beginning, to keep businesses operating, to keep them functioning. And then work on those that aren't vaccinated to get them vaccinated. So it's been a transition through all of this, and we try to put the rules in place to allow people to continue as much as possible with maintaining their business or maintaining some sort of daily routine.
Thank you. Sophie Desautels, Radio-Canada.
Sophie Desautels, Radio-Canada. Yes, hello. My question is for Dr. Russell. I'd like to know, where are the intensive care cases and where these people are hospitalized? Do you have that information from the hospitals? I know there are patients that are hospitalized throughout the province. It's not just one zone that is affected at this time. I don't know if I can give you the exact numbers. I don't have them in front of me, but we can try to come back to this after the press conference. Do you have a follow-up question, Sophie? Ms. Desautels? Callum Smith.
Hi there. I heard 57 of the new cases are under 19, but I'm wondering how many active cases are in youth not eligible to be vaccinated, and why is the province no longer sharing the case breakdown by age on the GNB dashboard?
I wasn't aware that the ages weren't being displayed on the dashboard. I didn't know there was a change to that. I assume that they are still available somewhere publicly, because we do have to report up nationally with those numbers. But again, I can come back after the press conference to address that, but I don't have that in front of me.
Follow-up, Callum?
Yeah, I guess, Premier, can you confirm if this mask mandate applies to all school-aged children, and do you see the broad mask mandate staying in place until children can be vaccinated?
Well, it does. Schools have their own protocol, which they have rolled out. But yes, the mandatory masking is part of that protocol. And in terms of timing, as I went through a little earlier in relation to the exposure, you know, it is proven to be, or the stats would show that kids, you know, can be rapid transmitters and transmit back to their parents and vice versa. Kids, we don't have children in hospital under, I think maybe under 12 certainly, but maybe even under 19, but certainly under 12. But we do have a situation where they can transmit, and that's why the masking, trying to reduce that transmission situation and avoid the hospitalizations and then keep the overall load in the system down. But in terms of timing, I think the timing is more related to getting the 90% level of vaccination in all of those who are eligible, because we don't know how long we're going to be waiting for 12 and under in that sense. So if we could get adults and we could get everyone eligible up to 12 and over at the 90% level, we'd be in a pretty good position.
Thank you. Dr. Russell?
Hi, I just have, I did find the information on how many people are hospitalized in each zone. So in zone 1, it's 5. In zone 2, it's 1. In zone 3, it's 6. In zone 4, it's 7. In zone 5, it's 3. And in zone 6, it's 1. And in zone 7, it's 0.
Thank you. Michel Corriveau, Radio.
Michel Corriveau, Radio-Canada.
Bonjour. C'est une question pour Dr. Russell. J'aimerais savoir, Dr. Russell, j'imagine que vous avez un plan pour ce qui s'en vient. Alors, qu'est-ce qu'il va falloir pour qu'on passe à la phase jaune ou la phase orange?
On n'a même pas décidé, Michel, si on va les nommer des phases ou des choses comme ça. Qu'est-ce qu'on a fait? On a nommé toutes les restrictions qu'on a déjà utilisées dans les derniers mois au niveau de la surveillance sur comment efficace chaque mesure est. Alors, c'est vraiment un calcul de quelles mesures qu'on va utiliser à ce moment-ci dans nos recommandations, en sachant que chaque sorte de mesure a une certaine mesure d'efficacité qu'il porte. Alors, on va avoir des discussions spécifiquement sur toutes les différentes mesures et lesquelles qu'on aimerait recommander pour mettre en place à ce moment-ci.
M. Corriveau, un suivi?
Oui, bien sûr. Merci, Bruce. Compte tenu des capacités là, du système hospitalier, j'aimerais savoir dans quelle mesure les hôpitaux prévoient plus de places parce que le nombre d'hospitalisations tend à augmenter et combien d'hospitalisations supplémentaires peut-on avoir sans qu'il y ait de problème?
Alors, chaque zone a leur nombre de cas spécifiques qui peut gérer à ce moment-ci. Mais on sait qu'avec la situation qu'on a eue des mois passés dans la zone 4, que fur et à mesure que la capacité est plus élevée, il va falloir soit transférer des patients à d'autres hôpitaux ou en plus que ça, arrêter offrir certains services. Alors, je sais que déjà, on a vu la situation qu'il y a des chirurgies qui ont eu être cancellées. On fallait les canceller. Alors, les mesures comme ceci vont continuer à se faire, mais c'est vraiment dépendant sur chaque hôpital et dans le système.
Merci. Bobby Jean McKinnon, CBC.
Yes, hello, can you hear me?
Yes.
Thank you. Just again, Dr. Russell, regarding testing, we've heard from a woman in Sackville who says she's been waiting for 4 days to get an appointment. She says part of the reason is she was told the center was closed over the weekend and that once she does get the test, that it could take another 4 days to get the results. So are centers being closed on the weekends? How long are these backlogs and what exactly is being done to shorten these times?
So we meet every day practically with our partners around the assessment centers and the resources and the time that's necessary to be able to get everybody tested and get those results back as quickly as possible. So with the surge in demand, again, there's always a lag between the time when we can ramp that up. So that is happening. I think right now all we are needing from people is to be patient. It is challenging, and I know Zone 1 is probably experiencing the biggest uptick in demand at this time. So we are doing our best. The RHAs are doing their best, and again, I understand that it's frustrating and challenging, and we'll just keep on keeping on and improving that situation.
Ms. McKinnon, a follow-up?
I'm sorry, just still that same question. Are the centers in fact being closed on the weekends, and how long are the backlogs?
Not to my knowledge.
Follow-up?
Okay, so do you know how long the backlog is? How long are people waiting? This one woman said four at least she's been waiting 4 days to get a test and was told it'll be at least 4 days to get results.
Yeah, I think it varies from place to place. Again, each zone has its own demands and ability to react and meet that at this stage. My understanding is every day it improves, so that's the direction we'd like to see it going. And again, we're going to continue to do our best to make sure that we decrease that time as much as possible.
Okay, thank you. Also for Dr. Russell, the Department of Health said Friday student transmission has now been confirmed. How many cases at which schools, and how will the school guidelines change in light of this?
I think they've already addressed that by the announcements they made last week, Bobby Jean, again with the masking, et cetera, and the type of bubbling that they're doing. But again, the most critical thing that every parent needs to do to protect their children is to get vaccinated, to make sure that every eligible household member is vaccinated, period.
Thank you. Simon Delatte, l'Acadie Nouvelle.
Oui, une question, alors soit pour la Dr. Russell, soit pour le Premier ministre. Est-ce que vous êtes inquiet de l'ampleur de la désinformation en ligne sur les réseaux sociaux au sujet de la vaccination? Qu'est-ce que vous voudriez dire aux gens qui manifestent notamment devant les hôpitaux et qui s'opposent en fait aux politiques de vaccination et aux diverses mesures de santé publique? Qu'est-ce que vous avez à dire à ces personnes?
Start with you, Mr.
Well, I would echo what we've heard from other individuals and certainly other people in the same position that I am. I find it appalling, really, that anyone would be opposing or standing in front of a hospital, and I referenced that in my earlier comments, and be basically harassing those that are going in to look after individuals that are there because they've chosen not to protect themselves. I mean, we all have situations where we find, we should have done something differently or we could have done something differently. But here we have cases that are making up, let's say, 75 to 80% of our people in ICU, if not higher than that are either unvaccinated partially or totally unvaccinated mostly. And when you have a situation that is preventable and so clearly preventable, and choose not to participate, but then to make it worse, but to actually harass those that are protecting those very individuals, it's kind of shocking, really. And I guess for me, I commend those that continue to go to work and continue to follow their professional guidelines in order to deliver the services that they are committed to doing. And so my hat's off to them, and I just ask for others to give some serious thought as to what they're really protesting and to how they too can make a difference and help us here.
Dr. Russell?
Je vais juste ajouter que on paye toutes les taxes ici au Nouveau-Brunswick. On paye l'argent pour notre système d'éducation. On paye de l'argent pour notre système de santé. on paye beaucoup d'argent pour nos routes. Il y a beaucoup de choses qu'on donne, nos dollars, le frais pour les taxes, pour tous les systèmes au Nouveau-Brunswick qui aident les Néo-Brunswickois. On veut protéger les ressources qu'on vient juste d'investir dedans depuis des années et des années. Alors, j'aimerais que les gens qui ont tout partagé dans cet investissement continuent à protéger les ressources. C'est ça qui va nous aider pour continuer à offrir des services de santé pour tous les gens du Nouveau-Brunswick, pour les maladies pour COVID et aussi les maladies non COVID.
Monsieur Delatte, as-tu un suivi?
Oui, pour certains hôpitaux, notamment l'hôpital Georges Dumont à Moncton, la semaine dernière, on a constaté que le nombre de patients en soins intensifs était plus élevé que le nombre de lits disponibles. Alors, qu'est-ce que ça signifie? Comment on fait face à une situation comme celle-là et c'est quoi les conséquences? Donc, plus généralement, quelle est notre capacité hospitalière? Est-ce qu'on est en mesure d'accueillir davantage de patients COVID actuellement?
Alors, chaque hôpital dans les réseaux nous donne leur numéro le pourcentage de capacité qu'ils ont. Et quand que la capacité est vraiment en risque, ils commencent à faire d'autres choses pour diminuer les risques. Alors, au lieu de fonctionner à la capacité de 90% ou 95%, ils vont diminuer la capacité à peut-être 85%. Ils vont commencer à canceller des chirurgies et c'est dépendant non juste sur la capacité le nombre de lits et les choses comme ça, mais c'est aussi vraiment dépendant sur la capacité des ressources humaines. On sait que les infirmières sont vraiment impactées quand que le système n'a pas vraiment la capacité, quand il y a trop de patients qui nécessitent des services, des soins intensifs et des autres services comme ça. Alors, c'est vraiment une balance et on sait qu'à un moment donné, s'il y a des transferts de patients qui devront se faire, c'est ça qui va être fait aussi.
Merci, M. Delatte. Merci, Docteur. Merci, M. Premier ministre. Tom Bates, Brunswick News.
Good afternoon. I'm looking for either of you to describe the approach government is taking to improve vaccination rates among attendees of churches or other religious sites in the province. I understand Minister Shepherd met with faith leaders on this question recently. Must churches comply with the same mandatory vaccination policy as businesses or employers, and how will this be enforced, if at all, I suppose?
So you are correct. Minister Shepherd did have discussion with religious leaders throughout the province, and yes, churches will have to comply. A very large number of our cases have happened as a result of assemblies that have been religious based, and they will need to comply. What we're doing here is working with the church leaders, and we're saying, okay, so can we validate that you have 90% of your regular adherents attending church and they are fully vaccinated? If you can't validate that, then there is a need to go the next step, in which we're talking here about the fully masking. But in indoor facilities, as we've talked earlier, if you can't prove that you're fully vaccinated or to the 90% level, then the next step we'll be looking at is going back to likely social distancing and the reduced spacing requirements, and so we want to work with every particular facility in order to try to make this happen. But we do know that we have, and it's the minority of churches, and it's great to see large gatherings of younger people. There's no question about this, but we can't do that right now in unvaccinated individuals. And we need to make sure that is not happening, because it has been identified as a major cause of the current spread that we're seeing. So we will continue to work with churches. We hope that they will be vaccinated to the level, but if they're not, then further measures will be required to ensure that they follow the rules necessary to prevent additional spreading at their events.
Mr. Bateman, a follow-up?
Yeah, I guess I'd like more information, perhaps from Dr. Russell, on specifics around the spread of COVID-19 we've seen as a result of these congregations. Can you be more specific or give some numbers?
Well, I can say that, again, we have the patterns of transmission established in terms of where we're seeing outbreaks, where we're seeing transmission, and everything that we're doing right now is around trying to address that at the same time that we're trying to mitigate the risks to the healthcare system. So, you know, early on in the summer when we were offering vaccinations, we definitely made sure that we had very creative and innovative approaches to reaching all the different vulnerable sectors, making sure that we communicated with the people and made sure that the access was there. We made sure that doses were available. I think there's lots of things that have been done so far with respect to trying to reach people and get them vaccinated. And I think there is an individual responsibility to make that happen. Collectively, the protection is what we really want to see the uptake of vaccination right now. We are seeing a lot of exposures in churches. We encourage people to check the websites for all the exposure sites. And it's, again, we're at a very critical time, and it's difficult to have these conversations now when the access has been there for so many months and weeks. So I did say this at the last press conference that, you know, we were trying to maintain our ability to have as open a society as possible. Public health measures are never something that we want to have out of balance. So all of the public health measures that we recommend are in keeping with the size and nature of the risks that we're trying to manage. So we are at a critical point right now where everything that we've done so far in terms of offering vaccination, et cetera, we haven't really had the uptake that we need to protect ourselves and have the most open society that we can right now. We know that, again, the impacts on people's mental health was quite severe over the course of the pandemic. We do know that, again, you know, social networks were impacted, businesses, economy, people's livelihood was impacted. These are all unintended consequences when public health measures are necessary, but we do make those decisions in terms of the recommendations as needed. But right now, the call to action is for every single person who is eligible for vaccination to get vaccinated. Please help those individuals get vaccinated. Please have conversations with those people and help them in any way you can. If you're in a position of leadership, I implore you to make sure that everybody who's part of your community in whatever way that you lead in your organizations are vaccinated.
Thank you. Savannah Odd, Brunswick News.
I'm really sorry for the construction in the background. Believe it or not, this is the best I can do in my building right now. So if you can't hear me, let me know.
We can hear you.
I understand from all party leaders, Public Health on Friday shared case projections based on our current situation with the COVID committee. So what exactly are Public Health's projections, and do we know roughly when this wave might peak?
Right now, the projections were to hit 100 cases a day in the next week or so. I don't doubt that we'll probably hit that sooner rather than later. The masking policy hopefully will help, but there will be a lag time where you would see that kind of an effect. But more important than the masking right now is getting people vaccinated. And again, there will be a lag time as well from the time that people get vaccinated with their second dose and are 14 days out in terms of that effectiveness. So we have many weeks ahead of us to really try to manage this. And again, the hospital system itself has its internal mechanisms to manage this in terms of the situation with their resources and bed capacity at this time.
Ms. Odd, do you have a follow-up?
Yeah, I'd like to get back to the masking restrictions. The Premier had cited projections vaccination rates would continue to rise and meet our target, but our vaccination rates have clearly slowed down during the weeks after August 2nd and even for the week before that. So I guess I'd just like to ask Dr. Russell, you've called this situation grave. How much of this could have been avoided if we had brought some of these simple measures back earlier, like the mask mandate?
That's a great question, and I think I've actually answered that already in other press conferences, but I am happy to answer it again. We can't really know for sure, other than what we knew at the time going into the green phase, knowing what public health measures have effect they have, not only in a positive way against COVID, but also in a negative way in terms of unintended consequences on people. Economy. So balancing all of those things at the time that we went to the green phase was really first and foremost in our mind in terms of mitigating risks. Now we're in a different situation. Now we're dealing with the reality of not having enough people vaccinated, and again, we continue to push that message, and we continue to really require that for the most protective way in terms of ensuring health care services are being able to be provided to all of our citizens. I think every New Brunswicker is at risk right now of not being able to access healthcare services once that capacity is exceeded. And I think that's the part that everybody who hasn't been vaccinated up until now, and friends and family of people who haven't been vaccinated up until now, need to understand and need to communicate. All New Brunswickers are at risk when we exceed the capacity of the healthcare system.
Thank you. Thank you, Ms. Odd. Mesdames et messieurs, ladies and gentlemen, that concludes today's update. Voilà la fin de notre mise à jour. Merci beaucoup.